Hello and welcome back to Rural Health for You and Everybody. I'm Amber Sorensen, the Marketing Director at the Murray County Medical Center, and I'm here with Karen. Hello, Karen. Why don't you introduce yourself to our listeners?
My name is Karen Honermann. I'm a registered nurse here at Murray County Medical Center, and I have been here for almost 42 years. And that's just been because I love it here. It's a great group of people to work with, and we have a great community that supports us, and it's been an enjoyable time.
Great to have you. And today we're going to talk about the cardiac rehab services offered here at MCMC. So just to kind of start off with, Karen, would you kind of go into a bit of depth on what is cardiac rehab just in general, and how does the program offered here at MCMC specifically work?
Cardiac rehab consists of helping a patient who's had a specific diagnosis related to heart issues. So we receive a referral from a cardiologist, and that has to do with a patient who's had a procedure, probably like heart surgery or bypass surgery as it's known, a patient who's had a heart valve replaced, a heart attack or an MI, or who has angina or chest pain that is unstable, meaning it can come and go at any time. So after we receive that referral, I contact the patient and we set up a time that we can meet. Usually our first meeting will just kind of be an introduction to each other. I'll get to know more about you, what you had done in the past, maybe a little bit more about you personally. Family. Do you have family that's close that can help you out? Do you have specific restrictions otherwise, such as arthritis or maybe some breathing issues? So we'll talk about all those kind of things. The program here at Murray County Medical Center includes having the dietitian visit with you if that's something you need or want. Often people will come to our facility after the episode with a specific diet requirement, and so we can help you figure out what that is. If you're supposed to be on a low salt diet, what does that really mean? If you're on a heart healthy diet, what does that really mean? We will go through your medications, review those, make sure that you're taking your medications correctly. Sometimes making some suggestions on how you can remind yourself to take those medications promptly. And probably most importantly, knowing what they're for, what they do for your body, your heart, and the importance of taking them consistently. And then the basis of the program is exercise. So we want you to build up your strength and endurance. We would do that with some warm-up exercises, with some exercises that will get your heart kind of pumping up a little bit. And then we have basically two pieces of equipment in cardiac rehab. The new step, which is very much like a seated bicycle. You have a nice support for your back. It works your arms and your legs. We can increase the intensity and the workload as specific for your needs. Same for the treadmill then. We can increase the speed, the duration, the elevation. So these exercises are tailored specifically for you. I'm not a runner, and most people aren't either. And so we're not going to do anything that makes you break a sweat, or we're not trying to turn you into an Olympic athlete. We just want you to be able to do the things that you do in your everyday life. Climb stairs, walk your dog, be able to play with your grandchildren. So it's tailored specifically to your needs.
Cool. Very cool. Kind of to follow up with that and maybe go a little more in depth. You mentioned specifically tailored to people's needs. As far as if I was a cardiac rehab patient and I came in, would that be kind of a weekly thing? Would that be twice a week, or does it kind of depend?
The schedule for cardiac rehab is often 3 times a week. So we meet on Monday, Wednesday, Friday. Generally, sessions take about an hour. By the time we talk about what's been going on since the last time we've met, we go through our warm-up exercises. We do the actual exercise of the new step and the treadmill. We do some cool-down things and some hand weights. Often people will have a regularly scheduled time. So your time might be Monday, Wednesday, and Friday from 10 a.m. to 11 a.m. Only 1 hour, not all day. We would make exceptions for people who maybe have a doctor's appointment or a family event that they want to attend. So I'm pretty good at juggling schedules. Sometimes something comes up for me. I might have a meeting I need to attend. And so between you and I, we're very easy to work with as far as rescheduling if something comes up. People often ask me, well, if I start this, do I have to come the entire time? Which is 36 times usually allowed by insurance and or Medicare. And I tell people that's also a very individual thing. Most people find that once they start, they feel better and they are very willing to finish all 36 sessions. Sometimes we might get to a point in their life where maybe people are returning back to work and it's not fitting in so well with their work schedule, and then we'll make a decision there.
Very good, very good. And you mentioned one question that you get sometimes. Are there any other frequently asked questions or maybe even some common myths that you've run across with cardiac rehab?
I think one of the myths is it might be cardiac rehab is just a one-time thing. It's something that I do for 36 sessions and then I'm done. And while that's basically true, what we're trying to encourage you to do is find ways that you can continue exercise or physical activity after you've completed cardiac rehab. That would include a free month at our wellness center here in Slayton, the Steve Coors Wellness Center. But not everybody lives in town. Maybe your particular area has a wellness center in the city that's closest to you. Maybe you can find a buddy to go with you and walk the track in the summer. Maybe we can encourage you to walk your pet when the weather is good. So to encourage you to exercise for lifelong wellness, I would say some of the best questions come around medication use. The doctor told me I need to take this medication, and he said it's for my heart, but I'm really not sure what it does or what it's for. Since I've started taking this medication, I feel lightheaded sometimes. Is that normal? What can I do to prevent that or to work with that? Some people are concerned about the cost of their medications, and we try to work out various avenues to take care of that. I think the biggest thing is that exercise really is a medication in itself. We just need to do it.
Very true. Very true. How would you say, I know you went a little bit in depth, but how would you say that our program here might differ or maybe be better, if you want to toot your own horn a little bit, than other programs that are offered in the area?
Well, I would say for the most part, our program is very individualized. We do one-to-one sessions. So anything you say or do while we're together during that hour is absolutely confidential. It's not like you're working in a room with 3 other people who are also doing cardiac rehab. If you're meeting with the dietitian or myself and we're talking about food and diet, again, that's one-to-one. You're not in a group. You don't have to feel like there's a question that you can't ask. Sometimes I tell people if there's a specific recipe that your family enjoys, bring it in and we'll work on ways that we can make it more heart healthy. I think the biggest thing here is that we are so flexible with our timing. If people can only come on Tuesday and Thursday, I'll make that work to the best of my ability. It's close to home. People that see providers at other areas will often come here for cardiac rehab because it's close to home, and they appreciate that, and it makes it easier for them to continue.
For sure. And how would you generally aim to help every patient coming into cardiac rehab achieve some of the goals that they may have, either right away when they come in, or maybe they voice those goals a few sessions in? How would you help them achieve those goals?
Well, I think the most important thing is to ask the patient what their goals are. Sometimes it might be just as much as being able to stay in their own home. And to do that, they need to climb a few steps to get into their home from the garage, or they may need to climb stairs to get into their bedroom at night, upstairs. As people start out, I think they're afraid that they're going to have to work super duper hard to do cardiac rehab. And that's not the case. We do things gradually. And I think sometimes people are surprised, a third of the way through the sessions, I might say, today your MET level was 2.6. And do you know when you started, your MET level was 1.9, which is a way to measure exercise. And they're like, wow, I didn't realize that I had made that much improvement. So as we go along like that, sometimes people will say, I didn't think it was possible, but I'd like to know, am I going to be able to play with my grandchildren? Am I going to be able to go on some hikes or some walks with them? And absolutely, sometimes it's best to have a goal like that. To think that you're exercising every day for no reason it just makes it tedious. So when people have a goal in mind, it makes it more real. I always want people to think about this in their real life. This isn't just a session or just something they have to get through, but with their goal in mind. Or do you think I'll be ready to go on my vacation to Alaska this fall? Absolutely. We'll work toward that goal.
Perfect. And would you have anything else that you'd like to add about cardiac rehab as a whole, or our program at MCMC?
Well, I would say that one of my favorite things is to see patients out and about in the community. So I've had patients who have presented to sessions for the first couple of times in a wheelchair. They didn't have enough effort or strength to even make it down to the cardiac rehab room. And pretty soon, after a few sessions, they're using a walker and then a cane. And eventually they might say something like, could I come on Thursday instead of Wednesday? I'm going out with my friends to a birthday party. And that's how easy it is to see progress, and then to see the people that have come through the program here and see them out and about walking, see them at different events and activities in our community. I just kind of give them a little wink sometimes, and they'll smile and say, Yeah, you helped me get this far. And I guess that's the greatest pleasure is to see that it really is a worthwhile effort.
For sure, for sure. And just before we go, can you give our listeners one more explanation of how they get those referrals in for the program?
If you have seen the cardiologist and have a qualifying diagnosis, if you are a Sanford patient, they will get that information to me through the Epic charting system. If you have your procedure or event taken care of at another facility, such as Avera or the Mayo Clinic, we can get faxes from those cardiologists. They most often contact me first. So it's nothing that the patient has to do. The hospitals pretty much automatically do it. If you don't hear from them or from me, give me a call and I'll see what I can do to get you started.
Sounds great. Thank you for joining us today, Karen.
You're welcome. My pleasure.